Welcome to Unit 1 of this module on detecting and managing STIs in pregnancy. In this unit, we will look at STI screening, treatment, and recommendations for infection prevention. By the end of this unit, you will be able to outline the opportunities for STI screening prevention, outline STI treatment during antenatal, intrapartum, and postnatal periods, and summarize recommendations for infection prevention. Many opportunities exist for STI awareness raising, prevention, screening, and treatment during the antenatal, intrapartum, and postnatal periods. Awareness raising, prevention, and screening are key to reducing the overall community burden of STIs. Accurate STI detection and diagnosis, appropriate treatment, and follow-up visits help to prevent complications, break the chain of transmission, and slow the development of antimicrobial resistance. By applying these principles and practices in your daily work, you can do your part in controlling STIs, supporting healthy pregnancies, and ensuring that available antibiotics remain effective. There are 3 main ways to support STI prevention work. 1. Think about STIs often in pregnancy. This means remember to think about STI prevention, screening, diagnosis, and treatment during pregnancy, labor, and childbirth, and during the postnatal period. 2. Screen and diagnose STIs accurately, following steps to guide your decision-making, from history to examination and laboratory results. 3. Give effective treatment for any STI detected using treatment tables to select the most appropriate treatment for the conditions identified. And remember, effective STI service provision must be respectful and free from stigma and discrimination. STI prevention is as important during pregnancy as at any other time. A woman's sexual activity may increase or decrease, and the risk of STI exposure may change. A number of STIs can cause complications during pregnancy and contribute to poor pregnancy outcomes. This includes syphilis, gonorrhea, chlamydia, trichomoniasis, genital herpes, and HIV. RTIs also pose risks during pregnancy. Bacterial vaginosis is common in pregnancy and associated with preterm labor. Treatment of symptomatic bacterial vaginosis can reduce the risk of preterm labor. Yeast infection, or candidiasis, is more common in pregnancy, and although not associated with adverse pregnancy outcomes, symptoms may be unpleasant and women should receive treatment. Upper genital tract infection and sepsis, which can be life-threatening, may be a complication of spontaneous or induced abortion, rupture of membranes, or may occur following childbirth. Some of the most important STI-related problems in pregnancy, including post-abortion and postpartum infections and congenital syphilis, are not technically difficult or expensive to manage or even to prevent altogether. Yet, maternal and perinatal morbidity and mortality related to these infections remain high. Simple improvements in clinical management using available technology can lead to dramatic improvements in pregnancy outcomes. For example, same-day, on-site syphilis screening and treatment in antenatal clinics. Treatment of symptomatic bacterial vaginosis can also reduce the risk of preterm labor, while prevention and effective management of postpartum and post-abortion infections can greatly reduce maternal morbidity and mortality. Simple improvements in service delivery can also lead to dramatic improvements in pregnancy outcomes. For example, in terms of education and counseling, women of reproductive age should be educated about the importance of early antenatal care and STI prevention and screening. Couples should also be counseled during pregnancy on STI symptoms and about safer sex during pregnancy. In terms of prevention and detection, women should be encouraged to attend A&C clinics early in pregnancy to maximize opportunities to prevent and detect STIs. WHO provides guidelines for high-quality, respectful A&C services, as well as tools for identifying women who need additional care. During pregnancy, labor, childbirth, and postnatal periods, prevention and detection of STIs and other RTIs should continue to be considered by you, the clinician, and talked about with the patient. STI risk may persist in pregnancy, so prevention and screening are important to protect the health of the mother and her partner as well as the child. Simple measures can be taken to reduce uncomfortable RTI symptoms. Additional opportunities for prevention and detection of STIs and other RTIs involve raising awareness about STIs and promoting screening with community health workers. As part of the primary healthcare team, along with doctors, nurses, and midwives, community health workers can provide information and support to women during and following pregnancy. We'll now look at opportunities for STI detection and management at each A&C visit. The first A&C visit is a critical opportunity to discuss STI risk and prevention, ask about symptoms, and screen for STIs. All women should be screened for syphilis, HIV, and hepatitis B, and where possible, for gonorrhea and chlamydia. Women with previous spontaneous abortion or preterm labor should also be screened for abnormal vaginal infections. Where possible, testing should be done at the time of the visit so that any treatment can be given before the woman goes home. This minimizes treatment delays and untreated STIs lost to follow-up. At subsequent A&C visits, information about STI risk and prevention should be reviewed and reinforced. Even if all screening tests at first A&C visit are negative, a woman can acquire an infection at any time if she or her partner have other sexual partners. It can sometimes be challenging to discuss STI risk and prevention during pregnancy without sowing doubts or discord within couples. When STI treatment and partner treatment is needed, careful counseling is especially important to ensure understanding and compliance with the aim of ensuring a healthy pregnancy. We will look at partner counseling in more detail in Module 4. At the time of labor and childbirth, there are a few things to think about with respect to STI. A primary HSV-2 infection around the time of childbirth can cause serious infection in the newborn. If genital ulcers are detected in late pregnancy, the mother should be started on treatment. If symptoms suggest a primary HSV-2 infection near the time of labor and the mother is not being treated for HSV-2, cesarean delivery may be indicated. Following childbirth, all newborns should routinely be given prophylaxis against ophthalmia neonatorum. After childbirth, the focus is on preventing or managing postpartum infection. So during the early postnatal period, women and their clinician should be alert to the symptoms and signs of postpartum infection, which require urgent attention and possible hospitalization. Babies born to mothers with syphilis during pregnancy require follow-up, whether the mother was treated or not. Finally, counseling about STI prevention and family planning should be provided as the couple resumes sexual activity. In all healthcare settings, practitioners should carefully follow recommendations for infection prevention. Remember that it is important that you and your patient practice good hygiene and frequent hand washing. Infection prevention also protects patients and clinicians from COVID-19. You have now completed Unit 1, STI Detection and Management. In the next unit, we will look at STI screening.